Hi everybody, Dr. Stetzer here. Um, I wanted to review PICO questions based upon some of the information I'm seeing posted on Forum 4. I thought this review might be helpful to you as you work on this and work on your thinking around your research questions. So PICO questions are very useful when constructing a research question because they assure that you hit on all of the key elements for a solid research question. The other reason they're helpful is that they also provide you then with some of your key terms for when you do your literature review. So as a reminder, P is the population of interest, I is the issue or intervention, C the comparison with another issue or intervention, O the outcome of treatment, and T the time frame. So P for population, this has you hone in on who you're interested in studying. And you want that clearly defined. Who is this population we're interested in? So it could be particular patients. It could be healthcare providers like novice nurses versus managers. It could be looking at families like a multi-generational family, the family of a new child. And if we use the study that we worked on, the advanced practice nurse phone call study, then the population of interest there was first-time moms, low income, normal birth weight babies. So for low income, first-time moms with normal birth weight babies. When we get to the intervention or the issue of interest, here you're going to want to be hone in on what is your concern. You don't want to be overly broad in your examination. And when you start thinking about interventions, such as in the study that we worked on, we were looking at a phone call from an advanced practice nurse. So you're going to focus on interventions that are within the sphere of nursing practice. You're not going to look at other providers and provide an intervention for them unless it's in partnership with nursing. You do want to be specific. Being too general may make it difficult to actually determine whether the intervention was the one that actually made the difference. You want to be open to thinking about shifting your lens. So all of you are picking topics that are very interesting to you, and you're picking interventions based on opinions that you have, things that you've seen. But you want to make sure as you delve into the literature that you stay open to the idea that perhaps this intervention or this issue may need to be fine-tuned a little bit. That's how you prevent researcher bias on your part. So the comparison, and let me just go back. So I believe I said that the intervention in this case was the APN phone call. So the comparison then is you could compare with and without an intervention. And I call that sort of the intervention and then usual care, which is really what we saw in the APN study. So we had the control group who got the usual discharge instructions, and we had the intervention group who received the usual care but also had these follow-up calls. So it's not ethical to withhold something that's usual care when we're looking at these interventions, but you could compare the new intervention to what normally happens. You could compare similar interventions. So in this case, using the APN phone call, maybe the APN versus an OB nurse, and perhaps because the APNs have a higher level of education around diagnosis and treatment, maybe they would hear things differently than the OB nurse would on a phone call. But those are still somewhat similar interventions because both are making the call. And then the last one is comparing populations. So sticking with this study, we had a control group, so it was the same population, but they could have compared low-income first-time moms of normal birth weight babies versus low-income first-time moms of low birth weight babies. And then those are the two different populations that are being compared. So some of you are starting to look at outcomes in that comparison area, but what you're really thinking about is the difference between what's currently the current state is and what this intervention is going to do. And then the outcome is, so what do we hope is going to happen here? So in the case of the APN study, we hoped for better maternal outcomes, and that was based on the researcher using a variety of tools about maternal stress and sense of well-being, positive infant outcomes in terms of being on schedule with immunization, not using the emergency room, and then finances. So less cost. So those were the outcomes for that particular intervention. Time frame is one that sometimes is used, but not required. It can be helpful, though, in determining whether or not one wants to continue using a particular intervention. So in this case, after these multiple phone calls, if maternal well-being, infant health, and cost, if those were all positive outcomes, then it would be helpful in terms of making the case for funding and continuing this APN phone call. So I am hoping that this helped clarify the different components of writing the PICO question by tying it back to a study that you're already familiar with. If you have any questions, I'm happy to answer them. Please just send me a message, and I look forward to seeing your studies and your plans and what you're thinking about.